ASCO annual meeting, and I'm joined by Robin Lally and Marilyn Hammer. Thank you both so much for coming on today.
Thank you for having us.
Would you like to introduce yourselves and share what your work and your research focus on?
Sure. I'm Dr. Robin Lally. I'm a professor at the College of Nursing at the University of Nebraska Medical Center, Fred and Pamela Buffett Cancer Center. Got long. My work focuses on the psychosocial support of women with breast cancer.
Great, and thank you for having us. I'm Marilyn Hammer. I'm the director of the Cancer Center for Research in Nursing and Patient Care Services. I'm also part of the Division of Population Sciences at Dana-Farber Cancer Institute in Boston. And my program of research focuses on precision health, symptom science, and really understanding underlying mechanisms that can help explain all of the inter-individual variability in symptom experiences.
Awesome. So you're both the PIs of the COACH study. What is this study investigating?
So the COACH study is a multi-center randomized waitlist control trial in which we are evaluating an mHealth augmented coaching program to help patients who have completed primary therapy for cancer. And it's really novel in that we're not only testing this intervention of the coaching program itself, but we're also collecting a lot of patient-reported outcome data so that we can really understand how symptoms transitioned over time into long-term survivorship. And we also have some novel areas of data collection, including microbiome samples to really understand how the microbiome might change and impact symptoms over time, as well as using a wearable device so that we can collect data in real time, because individuals are dynamic, not static. So I think it's novel in several ways. And then the collaboration that's both interprofessional and among the different institutes is really something that is, I think, very unique. And importantly, it's a nurse-led study.
Definitely. It's such an exciting and important study.
Just to add, you said we have 6 sites and collaboration with NCI in doing our analysis of samples as well.
Great. So, how many patients have enrolled so far?
Well, so far we have 120. We just started in June of 2022 enrolling. We hope to be done by 2024. The goal is 550 subjects altogether. Each site has been contracted for around 100 patients each. So we're making good progress. And Nebraska, where I'm at, we've enrolled 64. We were the first one to start enrolling. We've enrolled the most. So.
Definitely. So what has the experience of the patients been so far?
Well, the experience has been very positive. We were very excited to find that the survivors, and I'm not sure we defined how we define survivors for this, we are enrolling individuals who have completed their primary treatment within the past year. So individuals can still be on some maintenance endocrine therapy, for example, for breast cancer. But they need to be fairly recent survivors. And we were just really happy that they seem to be quite eager to sign up for the study. And our retention has been very good. I believe we were told today somewhere around 85 to 90%.
Great.
Even though they're asked, as Marilyn just said, to have wearables, provide microbiome stool sample twice, and complete a lot of study surveys. They're hanging in there, and they seem to enjoy the coaching.
It's great. Anything you'd like to add?
Just to back up what Robin said, that they are very engaged. They're very enthused about participating, and the feedback we've gotten so far is that they're really enjoying it, and we're really eager to start to see some of the data outcomes.
That's amazing. Do you have any advice for centers who are interested in incorporating digital health into their programs?
Yeah, so I think we're at a time where it's really important to do. You need a good supportive system, so that is really key for the Institute to be able to support it. But one of the things that is potential for this, which we're going to look at long term, is that it's potentially cost savings. So if these coaches can help with self-management, in which the patients, in this case with survivors, but could be anybody also undergoing cancer therapies, if they can help to self-manage their symptoms and quality of life, then that might reduce the number of phone calls to the providers. It could reduce potentially the number of unplanned, unscheduled visits to healthcare facilities. So I think it has a lot of wonderful and exciting potential moving forward. And then ultimately, if it can connect with electronic health records, that would be another huge goal so that we could help better communicate and work with patients.
Definitely.
Well, I could just add that we know that the number of survivors is growing and growing. They project by 2024 is going like 22 million cancer survivors. So self-management of symptoms and maintaining health and reducing recurrences and all of that, because we're looking at variables having to do with physical, psychological, social health, and we're enrolling this wide variety of individuals with a wide variety of cancers that will provide data for years to come. So.
Awesome. It's a really impressive trial. I'm looking forward to hearing more about it as it all plays out.
Yeah.
So more of a general question for you.
Yeah.
Do you also have any advice for people who are interested in becoming involved in nursing research?
Yeah, so first of all, we encourage people to become involved in nursing research. We need more PhD prepared nurse scientists, and just be passionate, I would say, with an area of research. A lot of our questions come from clinical practice, and just follow your instincts in terms of what to study. But importantly, form strong mentorship teams, strong research teams, be very collaborative, and then also you can kind of figure out the best setting. So some prefer the academic setting, some prefer a clinical setting. You can do a combination of both. But I think once you get into the area of nursing science, which is less than 1% of the nursing profession, there's just a lot of opportunities, and importantly, a really large opportunity to improve the lives of people affected by or at risk for cancer.
Yes.
I could just add something also unique about this study is at Nebraska, we have a co-PI relationship. So I am the PhD researcher from the university side of things, and the medical side of things, our director of cancer survivorship, which the survivorship department is just key to identifying these individuals for the study. But Dr. Rachel Schmidt is a DNP, so a Doctor of Nursing Practice prepared person. So individuals, if they should go, we need people to do PhDs. They're the research experts, but we also need to do these collaborations with our clinical expert partners, and that is the best way to do research and be a nurse scientist, is having that. Oh, and also our interdisciplinary collaborations also with our medical teams as well.
Yeah. Absolutely. That's great to know. One final question I'll ask both of you is, since the theme of ASCO this year is partnering with patients, obviously this study is a prime example of how that can be done.
Yes.
Do you have any other advice for people who are, trying to partner with patients more in their practice?
But it's absolutely essential. I think for way too long we have been nursing and medicine, been in a vacuum, right, doing our science. And having those community collaborations is so important. In Nebraska, we have 500 miles across our state, and our patients have special needs. They're rural. They travel hundreds of miles to our only NCI designated cancer center in the state, and we really need to understand what is important to them and what they want to see in a program like this, and find out can they and do they want to have distant type coaching, right, for their health? Or especially for our rural folks, they're very embedded in their own communities. And that's a question that we have at our site, is how is this going to look when we look at the data, the feasibility for our rural participants? So.
Yeah, and I would also just echo that it's essential to have the input of patients. We have patients need to be part of our studies as part of the study team. We have patient advocates that will kind of weigh in with us, and the community partnerships are absolutely essential. We need to better reach underserved populations, which historically we have not done very well at, and it's it's time to really get out there. So it's the community partnerships, working with patients themselves as we design our studies, it is absolutely essential.
Definitely. This is fantastic. It was great to talk with both of you, so thanks so much for stopping by.
Great, thank you.
Thank you very much.